Hello guys, today we are going to talk about cirrhosis. Cirrhosis is an end-stage liver disease which is characterized by disruption of the hepatic parenchyma, uh, regenerating nodules, and the fibrosis. As you can see here, these are the regenerating nodules, and between the nodules, there are fibrotic tissue. Before I continue the lecture, I would like to talk about the anatomy. Let's assume that this is liver and this is spleen. This is portal vein. As you know, the portal vein is composed of three main veins. Splenic vein, which takes the blood from the spleen, and superior and inferior mesenteric veins, which take the blood from the small and large intestines. So when the blood comes from intestines, they first drain into the superior and inferior mesenteric veins, then to the portal vein, and then to the liver. And only after the blood is detoxified with the liver, only then it can go into the systemic circulation via the hepatic vein. This is common hepatic artery, which takes its origin from the celiac trunk. As you know, celiac tract gives rise to three arteries. One of them is common hepatic artery, other two are left gastric artery and splenic artery. This is left gastric vein, which takes the blood from the lower part of esophagus and also the uh, stomach. During cirrhosis, the vascular structure of uh, liver is disrupted, so the uh, portal vein can't fully drain into the liver, so the hypertension of this region develops. So during the hypertension of portal vein, the blood which can't continue its way to the liver backflows. When it backflows to the spleen, it causes hypersplenism, which is characterized by splenomegaly and also the hyper functionality of the spleen. And when the spleen functions too much, it consumes red blood cells and causes uh, anemia, and also it consumes platelets and causes thrombocytopenia. When the blood from portal system backflows to the superior and inferior mesenteric veins, they cause ascites. Ascites, that means accumulation of fluid in the peritoneal cavity. Of course, this is not the only way the ascites is formed. The other mechanism by which ascites is formed is decreased oncotic pressure, which is due to the decreased synthesis of albumin by the liver. Because, as you know, the main component of oncotic pressure is protein, and main protein that is found in the human body is albumin, and albumin is synthesized in the liver. And during cirrhosis, the albumin synthesis is disappeared, so the less amount of albumin is synthesized, which is the main reason why the ascites is developed. When the blood backflows to the left gastric vein, then esophageal varices develop. As you know, the esophageal varices is a medical condition which is characterized by dilatation of the esophageal vein, and the portal hypertension is the leading cause of esophageal varices. So let's talk about the etiologic factors of cirrhosis. The most common causes of cirrhosis are chronic hepatitis B and chronic hepatitis C. I have already made a video about hepatitis B, and if you have not watched it, you can check it out. Alcoholic fatty liver disease is a condition which may progress to cirrhosis if the patient does not give up consuming alcohol. Non-alcoholic fatty liver disease is the medical condition which also may progress to cirrhosis. The patient are generally obese and have insulin resistance. And the first thing that these patients are advised to lose weight and also use metformin. As you know, metformin is a drug of choice in type 2 diabetes, and because these patients have insulin resistance, metformin is generally prescribed. During non-alcoholic fatty liver disease, ALT is generally bigger than AST. However, during alcoholic fatty liver disease, AST is larger than ALT. Sometimes AST is at least twice larger than ALT. Wilson's disease is a medical condition which is characterized by disrupted Cooper metabolism. Normally, the Cooper is absorbed from the intestine and then it is stored in the liver. And when the body needs Cooper, the Cooper binds to ceruloplasmin and goes into the systemic circulation. However, in Wilson's disease, the Cooper can't bind to ceruloplasmin and so it can't enter into the circulation with the ceruloplasmin. So the uh, amount of Cooper in liver increases and it is extremely hepatotoxic. It may cause all sorts of hepatic diseases like chronic hepatitis or cirrhosis. As for extrahepatic signs and symptoms, the most prominent one is Kaiser-Fleischer ring, which is characterized by brown discoloration of the periphery of the cornea, as you can see here. Also, it may cause all kind of neurological signs and symptoms like motor deficit or some kind of psychiatric problems like depression or hyperactivity. Hemochromatosis is a medical condition which is characterized by increased iron level. It may be primary or secondary. As you know, in a healthy person, only 10% of iron is absorbed. However, in primary hemochromatosis, all of the iron that goes into the intestines are absorbed and gets into the circulation. And when this happens, the serum iron level increases, and the serum iron and the free iron is very dangerous, especially for the liver, and it may cause cirrhosis. The main cause of secondary hemochromatosis is blood transfusion. When it happens too much, especially in the thalassemia measure, the patient gets blood transfusion too often. And as you know, red blood cell contains hemoglobin, and hemoglobin's one main component is iron. And when a red blood cell dies, and as you know, the half-life of red blood cell is about 90 to 120 days, and when it dies, the serum iron level increases, and the body has no mechanism by which it can get rid of the iron. So the iron increases and it causes cirrhosis. Primary biliary cirrhosis is a medical condition which is characterized by autoimmune destruction of the intrahepatic bile ducts. It is seen generally in the women of childbearing age, and because it is autoimmune disease, it may be associated to other autoimmune diseases. And the autoantibody that is present in primary biliary cirrhosis is anti-mitochondrial antibody. Hepatitis is a condition in which the inflammation and fibrosis of the intrahepatic bile ducts occur, and the patients generally present with the signs and symptoms of obstructive jaundice. It is generally seen in the patient who have ulcerative colitis, and the patients the patients are P-ANCA positive, as the most of them have ulcerative colitis. In patients who have alpha-1 antitrypsin deficiency, the two main diseases that develop are cirrhosis and chronic obstructive pulmonary disease. Autoimmune hepatitis is when the patient's B and T cells attack to the hepatic cells and causes destruction in the hepatic cells, which may progress to cirrhosis. It is subdivided into two groups. First autoimmune hepatitis. First type of autoimmune hepatitis is seen in adults and is characterized by these self-antibodies: anti-nuclear antibody, P-ANCA, and also anti-smooth muscle antibody. The autoimmune hepatitis, which is seen in children, is associated by anti-liver kidney microsomal antibody. Budd-Chiari syndrome is characterized by obstruction of the hepatic vein. So when there is obstruction, the big flow of blood occurs and the liver gets also affected. It may cause the cirrhosis and also portal hypertension. In the beginning of the cirrhosis, the most patients are asymptomatic, but one of the first symptoms that they develop is jaundice. Jaundice, as you know, is the yellow discoloration of the sclera, and as the bilirubin level rises, the yellow discoloration of the skin also occurs. Pulmonary erythema is the condition where the uh, patient's palms get red. And gynecomastia is when the males have large breast. Both of these symptoms are associated by increased estrogen because estrogen is metabolized in liver, and when liver does not function properly, the estrogen can't be metabolized, so its level increases, and males also develop a female-like breast. Spider nose is the condition which is characterized by this type of skin lesions. It may develop in any part of the human skin. Nail clubbing is the deformity of the fingers, um, and it is seen not only in cirrhosis but also in chronic diseases of lung and heart. Especially in congenital heart diseases, nail clubbing is very prominent. Hypersplenism associated symptoms. I have talked about these symptoms when the spleen works much more than it is necessary, and it consumes red blood cell, it causes anemia, and when it consumes platelets, it causes thrombocytopenia. One of the signs and symptoms of cirrhosis is bleeding due to coagulation factor defects. As you know, most of the coagulation factors are synthesized in the liver, except factor 8. All of the coagulation factors are synthesized in the liver. So when the liver can't function properly, coagulation defects occur, and prothrombin time increases, and it may cause some mucosal bleedings, and also it may make it easier for esophageal varices to rupture and cause life-threatening bleeding. Edema due to hypoalbuminemia, as I have already told you, liver synthesizes albumin, and when liver can't function properly, albumin is not synthesized. So during hypoalbuminemia, the oncotic pressure decreases, which may cause edema. Especially the pretibial edema is very prominent. Cirrhosis may cause a lot of complications, but we will talk about the most important ones. Ascites is the condition in which the fluid accumulates in the peritoneal cavity, and it causes the abdominal enlargement, as you can see in the picture. If the fluid gets infected, then it's called spontaneous bacterial peritonitis, and the main cause is Escherichia coli. The treatment of ascites generally includes spironolactone, and if it is not sufficient, then furosemide is added. As for treatment for spontaneous bacterial peritonitis is, of course, antibiotics. Bleeding esophageal varices is the main cause of death in cirrhosis. I have already said the mechanism by which esophageal varices develop, and bleeding is generally caused by the fact that patients with cirrhosis have coagulation defects and also thrombocytopenia, and it makes it easier for esophageal varices to bleed. Um, the treatment or let me say the prophylaxis of esophageal variceal bleeding is generally beta blockers like propranolol. As for treatment for acute bleeding is generally drugs like somatostatin, and also endoscopic treatment like band ligation. Hepatic encephalopathy is also a complication of the cirrhosis, and let me explain its mechanism. When a patient with cirrhosis consumes protein-containing meat, the protein gets digested by pancreatic enzymes and amino acids are formed. The amino acids then go to the small intestines, and microbacteria flora which are found in small intestines convert some of these amino acids to ammonia. Ammonia. Ammonia then goes to the liver, and if the liver functions properly, the uric acid is formed. Uric acid is then excreted by the kidney. But if the liver is not working properly, then ammonia cannot be converted to uric acid, so the ammonia's amount increases. When ammonia as the amount increases, it goes to the systemic circulation, and when it goes to the systemic circulation, it crosses blood-brain barrier. When ammonia crosses blood-brain barrier, it binds to glutamine, which is excitatory neurotransmitter, glutamine, and they together form glutamate. Glutamate is not excitatory neurotransmitter nor inhibitory neurotransmitter. So when the glutamine is used to form glutamate, the amount of glutamine is decreased. So when the amount of excitatory neurotransmitter is decreased, like glutamine, and the inhibitory neurotransmitter like GABA is normal, that means the amount of inhibitory neurotransmitters is more than the amount of excitatory neurotransmitters. So this may cause a variety of clinical signs, starting from excessive sleeping to coma. The first sign of hepatic encephalopathy is generally excessive sleeping, and if it remains untreated, then it may progress to coma. The treatment of hepatic encephalopathy includes first of all to advise patients to take less amount of protein, because as you know, protein is the one that is then forming ammonia. And the second treatment, and the very important treatment, is to use osmotic laxatives. We want the patients to have diarrhea, because then if the stools remain very short amount of time in small intestines, then the less amount of ammonia will be formed, and hepatic encephalopathy will be alleviated. And there is also one topic that I would like to discuss about hepatic encephalopathy. There are several conditions in which hepatic encephalopathy can be developed. The first case is hypokalemia. Hypokalemia is one of the most important causes, etiologic factors of hepatic encephalopathy, and second cause is gastrointestinal bleeding. So if the patient with cirrhosis gets hepatic encephalopathy, first of all you should think of electrolyte disbalance like hypokalemia and also gastrointestinal bleeding, because these two factors are the main causes of hepatic encephalopathy. Also things like sepsis may cause hepatic encephalopathy. Hepatorenal syndrome is the condition in which the patient gets acute prerenal failure, which is characterized by decreased glomerular filtration rate. However, the histological image of kidney is entirely normal. In hepatopulmonary syndrome, a patient with cirrhosis gets intrapulmonary vascular dilatation, which then causes dyspnea. Dyspnea is especially prominent when the patient is standing, and when the patient lies down, the dyspnea disappears, and this condition is called platypnea. It is absolutely opposite of the orthopnea, which we see in the congestive heart failure. In order to determine the prognosis of the cirrhosis, child book criteria is used. The criteria is composed of the presence or absence of encephalopathy, ascites, the amount of bilirubin, albumin, and also prothrombin time. And the minimum amount of point that patient can get is 5, and it is considered as um, mild cirrhosis. As the patient's symptom gets worse, then the points he gets increases. During if the patient has a class C cirrhosis, then the only treatment that can be used for the patient is hepatic transplantation. However, the main criteria that is used to determine the usage of the liver transplantation is MELT criteria. MELT criteria is composed of the followings: blood sodium levels, blood creatinine levels, blood bilirubin levels, and also prothrombin time. So this was for today. I hope you liked the video. Don't forget to subscribe my channel and see you next time.